What do you want your body to be capable of? What do you want your body to be able to do? Okay, how are we going to get you there? Because that is a more profound question in my mind than how do we get rid of your hot flashes. Getting rid of hot flashes is easy. Anyone can do that.
Yeah.
But making someone the really honest to God, their best self, that's an art, and that's really what we focus on. As we continue to optimize people, it's almost like I just wanted to lose 10 pounds and be able to sleep and not feel awful, but now I want to run a marathon. Now I want to be able to play basketball with my grandkids. Your horizons start to open up as you start to see the results of what this kind of medicine can do for you. Optimization medicine is very, very different from disease care. Disease care is absence of suffering. Optimization care is the presence of something awesome.
What's the top 3 things that you're doing now that maybe 5 or 10 years ago you weren't as a practice?
We've known for a very long time that the human body should, in theory, have the ability to reverse any damage to itself. Our genes are the blueprint that make us us. Our genetic data does not change. When you're in a calorie deficit, your body tends to triage, right? It tends to get rid of the things that are less important. And hair, we care about a lot emotionally, but when it comes to survival, hair doesn't matter.
Welcome to the Health Signal podcast, where we make health data make sense. I'm your host, Boris Berian, and on this show, we connect with trusted health experts who help us decode the trends, science, and signals shaping our health. Whether you're optimizing for longevity, managing stress, tracking sleep, or just trying to make smarter decisions in a noisy wellness world, this podcast is your accessible expert. Well, let's get into it.
Flora, how are you today?
I'm doing so well. How are you?
Very
good.
This
meeting is being recorded.
Excited to chat with you, and I saw your notes, and our team did a lot of research before reaching out, so very excited.
Well, thank you. But before we get started with the formal questions, just 30 seconds. Who am I talking to? Who do you want me to be sort of putting what I'm saying together? Who's my audience? Who am I speaking to?
So you're going to have actually a little bit of both. So you're going to have about 6,000 practices that work with us that we email every week about the podcast.
Sure.
So I'm going to actually ask a couple of questions that are provider specific, and then we have over 20,000 patients that will also get an email around this. So typically every single podcast has a little bit of both, where they can, even on the practitioner insight, the consumers are like, oh, I understand how doctors are navigating this world, and then on the
or not, as the case may be.
or absolutely not, which is unfortunately a lot of the case, right? Or on the other front, what is working with clients and how they are, how they're getting results. I actually liked your suggestion. I will lead with the HRT stuff because that's super popular right now, and navigating a thing has been very stressful for both sides.
Yes, absolutely. And when you say 6,000 practices, primarily aesthetics and wellness practices, or all medical practices?
Primarily cash-based practice. It does vary.
Cool.
So we have a huge amount of weight loss clinics that we work with, functional medicine. We do concierge, not as much, med spa estheticians primarily, but just kind of like you, they have weight loss and hormone that they, it's like the whole body care system.
Got it. Okay.
So a lot of the audience has a lot of similarity to what you do.
All right. Okay, I got it. I can do that.
All right, perfect. Cool. I'm going to do a separate intro, so don't worry about me babbling for 5 minutes to introduce you. I can do that on my own. It's going to eat our time away. And with that being said, welcome to the podcast officially.
Well, thank you so much. I'm so excited to be here.
Absolutely. I think the place I'd like to start is something that you've been specializing in for a while, which is HRT for men and women. Specifically on the practitioner side, I'm going to start there. Kind of walk me through, I think there's a lot of misconceptions on, there's practitioners that are just giving, the drugs, the HRT and the replacements, and they're just following guidelines or even skirting them a little bit. And then there's people who try to optimize that or give a minimum dosage and then do other lifestyle interventions. And then you have, well, it depends what kind of client I'm servicing, right? And what their stickiness to the care plan is. So maybe let's start in terms of how do you approach it as a practitioner that does this, day in and day out and sees the results? What's your kind of hypothesis or synopsis that you've landed on?
Absolutely. No, I think that's a great question. And I think that question kind of cuts to the heart of the whole debate over how HRT should be done. And I'm going to answer that kind of on a high level first, and then I'm going to come down to like my specific philosophy. But you have to remember that in our country, our entire medical system is based on the idea of treating disease, right? Something goes wrong, you fix it. Something goes wrong, you fix it. And so physicians especially, but all medical providers are trained to think in terms of treating disease symptoms, right? Mm-hmm. So when HRT was kind of first being developed and first coming of age, it's this idea of we are going to treat the symptoms of menopause. We're going to treat the symptoms of andropause, which is, sort of the male equivalent of the hormones dropping off over time. And that is what the guidelines are set up to do. They are set up to give you the minimum dose necessary to shut you up. I say that with a laugh, but the minimum dose to take away the worst of your symptoms, right? And that's what most providers are going to do. That's what the guidelines are set up for. That's what the standard dosing regimens are set up for. Now, there's another philosophy, and neither one is right nor wrong, but they are different. And that idea is, okay, are we trying to treat disease? Or are we trying to optimize the lives of our patients? Because those are different things, right? Yeah. I can give you a dose that will take away your symptoms, but there may be different doses that are going to make you capable of things you were never capable of before. That's going to make your body feel optimized and like you can do anything, right? Mm-hmm. And those are different philosophies. I do not believe that the treatment of disease should be our highest goal, although it's a very important goal because disease is a horrible thing, right? Yeah. But really, I think our disease should be the preservation of health and the promotion of health and the promotion of optimization of each of our patients. That's a different philosophy. So in my clinic, I don't ask people, I ask what are your symptoms? Because of course that's important. But then I say, what do you want your body to be capable of? What do you want your body to be able to do? Okay, how are we going to get you there? Because that is a more profound question in my mind than how do we get rid of your hot flashes? Getting rid of hot flashes is easy. Anyone can do that. Yeah. But making someone their really honest to God, their best self, that's an art. And that's really what we focus on.
It's an interesting concept. I'm going to poke around a little bit here because my thought around what you just said is when you ask that question, and I might be overreaching, my assumption is most people don't know where they want to be. They're like, I didn't even think about it, is what I think their head goes to. Am I wrong? Is your patient or clientele maybe more savvy and forward thinking, or is this an aha moment where they kind of take a step back and go, actually, that's a good frame because I just had a problem. I thought you would fix it. I didn't know where I actually want to go.
Most of our patients come in because they're suffering, just straight out. They come in because they're gaining weight, they're tired all the time, they're anxious, they're depressed, they're miserable, their body is falling apart around them, and they know that doesn't feel good. They know that's wrong, and they don't know what to do about it. And so often it's very much a stepwise thing. We'll say, okay, what's your biggest concern? Okay, your biggest concern is you're waking up every night at 2 a.m, you can't go back to sleep. Okay, we'll fix that first. All right. Then as we continue to optimize people, it's almost like that scene in, I'm aging myself, but that scene in The Wizard of Oz where Dorothy steps out into Oz and all of a sudden everything goes from black and white to Technicolor. That process happens with our patients. And it takes about a year where all of a sudden they go, wait a minute, I just wanted to lose 10 pounds and be able to sleep and not feel awful. But now I want to run a marathon. Now I want to be able to play basketball with my grandkids. Your horizons start to open up as you start to see the results of what this kind of medicine can do for you. And optimization medicine is very, very different from disease care. Disease care is absence of suffering. Optimization care is the presence of something awesome. And those are very different things. And patients kind of wake up to it gradually over time. Very few people come in because I think it's an idea that everyone wants to feel like they're 25, right? Everyone, that was the best physical portion of our lives. Everyone wants that. No one believes it's possible. Very few people believe it's possible until they have seen it, either in themselves or a loved one. They are afraid to even ask that because it sounds crazy. Like, I want to feel 20 or whatever. You can't. Yeah. But the answer is, you want to be able to feel 20, but I can make you feel 30. And that's pretty darn good. So it comes on gradually.
Gotcha. Yeah. So it's kind of like, let's solve what you need now. And then once you're better, we kind of move that goalpost
Yeah,
to keep you motivated.
Exactly.
Awesome. Do you feel that you have to do that because patients lose sight of where they were and they're like, I don't really need to do anything else, I'm good now, and then can fall back into old patterns?
I actually don't see that as much of a problem because, I
Okay.
mean, you're absolutely correct. People do forget where they were.
Yeah.
And patients periodically will be like, hey, I feel good. I'm going to cancel. I'm going to, I'm good now. And I'm always like, absolutely do what's best for you. If in 3 or 6 months you notice that maybe you don't feel as good as you think you do, come on back. Because what happens is when you're hormonally optimized, nutritionally optimized, we are taking away 10, 15, or 20 years of the aging process physiologically, right?
Yeah.
And then what happens when you all of a sudden stop those medications, stop that program, you're going to get that 20 years of aging all in the course of 3 to 6 months. And that hits like a wrecking ball. And so people tend to correct their course very quickly
Gotcha.
in those
Yeah,
situations.
makes sense. So how do you approach, let's say you get somebody good in your practice, and then what's kind of is there a maintenance protocol or a longevity protocol that you have them go through after that?
Yeah, absolutely. So, I think that, of course, there's obviously, individual variation. I think that the most difficult management period is the perimenopausal female because everything is changing so rapidly. And you have to, as, each of the hormones drops off in a different time frame, and they don't drop off smoothly. Like progesterone will drop off relatively smoothly, but estrogen does this thing for like 6 or 7 years, which is bouncing up and down, and it can be very, very hard to manage. So with our perimenopausal patients, it's really a process of checking in on a regular basis.
Yeah.
We have to talk to them every few months and be like, are you having any new symptoms? Are you where you want to be? And we're constantly, titrating those medicines. Once people get into the postmenopausal period, it's much easier to manage because the ovaries are done, they've quit. And so then when the body's not doing any of this stuff anymore, then we find the optimum dose and it's relatively easy to keep them there. And then it's just a question of trying to keep up with the diet, the nutrition, the exercise, and that's different from person to person. But our protocol generally is to, during perimenopause, checking in very, very frequently. When we get to postmenopause, it's titrating to an optimum level and then staying there.
Gotcha. Going a little bit more back into the practitioner side, that makes sense, by the way, thank you. What are maybe what's the top 3 things that you're doing now that maybe 5 or 10 years ago you weren't as a practice that's really changed your outcomes and also how your business operates?
I would say that, a couple of things. So, one thing that is, I would say exploding is, I don't think is a overuse of the word in sort of the wellness and regenerative space. We've known for a very long time that the human body should in theory have the ability to reverse any damage to itself, right? Our genes are the blueprint that make us. Our genes, the genes you're born with, are the same genes you have at 45, they're the same genes you have at 95, with some small variations, but generally speaking, our genetic data does not change. And if our genetic data does not change, if the blueprint is all still there, why should our body have to change, right? That's the central question that underlies all of medicine, really, is why is our body changing if all the instructions are there? And what has become kind of, clear through the work of, thousands and thousands of brilliant scientists is that the data is all still there, but the genes deactivate, they turn off, right? And so the focus of regenerative medicine has turned into, how do we get the body to access the instructions that we know are there? How do we get those instructions to be turned back on? Hormones are one major piece of that puzzle, without a doubt. That's what they do, is they give our DNA instructions. They say, turn on this suite of genes. But now we are starting to see things like peptides coming onto the scene, which do the same job, right? They are much more specific. They're much more narrowly focused. Whereas something like, estrogen or testosterone will affect, thousands and thousands of genes throughout the body. Specific peptides will activate smaller suites of genes that give us a more nuanced ability to tweak different things inside the body. So what I would say the biggest change that's been happening in the sort of aesthetics and wellness space is we've gone from this model of, I would say, external intervention, things like filler, things like surgery, things like Botox, things where we are physically going in and we are manually doing something to the body, right? To this model of, can we send the body a biological message that just tells it to do its own repair, its own work, according to the instructions which we know are there? And That revolution is starting.
Yeah.
It's going to be amazing. 20 years from now, when you tear your ACL, you'll go in and get a shot. And that'll be it. And it will regrow itself. We have that capacity, but we are figuring out the signals that are necessary to be able to do that kind of thing. So I think the biggest thing that's changed in our view is we have an ability to regenerate tissue that we didn't have before. And that's really cool. Regenerating tissue is kind of the holy grail of like all things. The second thing that's really a big deal is right, the GLP-1s, which is the Ozempic, Wegovy, the weight loss medications. Those medications they're the drugs of the century. They are allowing us to fend off chronic disease in amazing ways, and also they make people look good in swimsuits, so people are willing to take them. That's always the problem,
which is always the real reason, right? Yeah.
Right, exactly. Like people come in because they want to look good in a swimsuit and have more sex, and I'm like, that's awesome. I want you to have all the sex you want, but for me as a practitioner, I do that by making them more healthy. And so that's how I'm able to like get the benefit that I want to see from it. But the GLP-1 drugs have revolutionized, all sort of aesthetic and wellness medicine, because they actually allow us to control for obesity, which changes everything. And that's been an incredible benefit to my patients. It's been a huge change. And, the third real thing is the rise of how's the best way to say it? When I was, again, dating myself, when I was in med school, physicians had to memorize all of the medical knowledge that existed, because there was no other way to get it. It had to be inside your brain. And patients didn't have any of that information, right? Because they hadn't spent, 4 years in med school and 3 years in residency and everything. They didn't, and there was no other way to get that information except go to the library, read a medical textbook. No one's going to do that.
Yeah.
And there are good and bad things about that model. But what's happened over the last 20, 30 years is that, information has been democratized. Our patients can get all the information that used to be specialized, like 2 doctors and 2 providers, is now available to everyone. And so our job has changed from being like the gatekeepers of knowledge, which again, there's pluses and minuses there, but the gatekeepers of knowledge, to being the interpreters and directors of knowledge. Patients come in, they say, I want this, 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 this. And I say, okay, absolutely. Let's talk about those things. And let's explain why that may be a good idea, why it's not a good idea. My job is less to explain things and like dictate information, and more to help guide people through this thicket of information that all of a sudden they have access to. So I think those are the three things that changed our practice the most. That's a little bit vague. I can get more specific, but that's the large picture differences.
No, I think those are really great points. Mainly because one of my good friends, he owns the largest stem cell clinic in Mexico, for example. The way they source and put cells, it's very fascinating when I went through the facility, right? And so a lot of people are not exposed to it. Like, these things take a long time to get traction and then approval and then become mainstream. So I agree, that would be, if I could just get a shot and I tore my ACL, like, perfect. Let me know when you have that as a procedure.
Ready,
I will buy that package immediately. I think the GLP-1s, if you can maybe touch on it a little bit more on, there was this huge wave of this is now the future, it's done so much good, and it's undeniable to say that that's not true. At the same time, what was coming up, because we see a lot of data and we talk to a lot of practitioners, it was almost this aura of there's nothing can go wrong with these things, right? Like, it's like completely the best thing ever. There's no side effect. And I was like, these are very well-known people saying these things, being slightly naive, in my opinion. Do you feel like your outlook has changed on those drugs in terms of administration, dosage, and how you guys tackle it? And maybe you do more things on top of versus just the drug, or not? Like, how has that progression unfolded?
No, absolutely. No, and I mean, yes, there is no medicine that does not have side effects. There's nothing that can't be done stupidly. like, if people can figure out stupid ways to do everything. Right? So yeah, I mean, I would say, I mean, just in the defense of the GLP-1s, if you think about the cost, not so much financial, but the human cost of obesity. we're talking 30% of solid cancers. We're talking, the vast majority, the driver of heart attacks, of diabetes, of stroke. So the burden of suffering, and that's a little melodramatic, but the burden of suffering that obesity causes is astoundingly big. So the side effect profile of a medicine has to be pretty bad before it's worse than what obesity does to our bodies. Now, that being said, can you do GLP-1s wrong? Yes. Yes, you absolutely can. So, the biggest problem with GLP-1s, and I think this is becoming more and more talked about now, is that left to its own devices, the body will pull fuel equally from muscle and fat, right? If the body has got a 500 calorie deficit, it's going to take half of it from fat, half of it from muscle. So, then what happens is the person they lose weight, but they're only part of the weight they're losing is fat, part of it's muscle. And then the muscle is responsible for our basal metabolic rate. It's responsible for our ability to burn calories at our baseline rest state. And so when you lose a bunch of weight and then you stop a GLP-1 and you've lost a bunch of muscle, the weight rebounds much faster because you don't have the ability to burn calories in the same way that you did when you still had, let's say, 5 or 10 extra pounds of muscle. You've lost that ability, right? So that's a very bad thing. What we have changed about our GLP-1 program is when we first started it, it was just like, here's the shot, go home, come back if you're vomiting, like we'll see you.
Yeah.
And now what it's changed to is the question is, okay, here's the shot. Now let's talk about how we're going to do this in a way that's healthy. We do nutrition planning for all of our patients. We talk about how you put together, people don't know how to put together a plate, how to put together macros, how to set up a calorie, sort of guidelines for yourself. We try to educate our patients on all of that. We try to provide them. We have a whole recipe library that we give them access to. Like these are good for eat these, So we have nutrition planning around it. We have exercise planning around it. Again, some people do, some people don't. And I know that there are people out there who will say things like, if your metabolic house is in order, you're not welcome here. Like if you are not doing everything that I ask you to do, you can't be my patient. And there's some purity to that. And there's a resonance that I'm like, oh my God, that'd be awesome. But the true fact of the matter is a lot of my patients are not going to exercise. And would I rather have them be sarcopenic, low muscle and obese? Or would I rather have them be sarcopenic and not obese? Well, sarcopenic and not obese is going to be is going to have less chronic disease. So I'm going to give them as much benefit as I can where they are. And we encourage them to exercise, we want them to exercise. If they're not going to, they're not going to. The other thing that we started doing is, it's very, very common on GLP-1 to be micronutrient deficient. Because again, people are they're calorie restricting and they're not getting the micronutrients. So every 6 months we'll do a micronutrient panel, take a look at where the B complex is, where their D is, where their iron is, because we've had patients become frankly malnourished, have vitamin nutrient deficiencies because they just are not eating a variety, wide enough variety. So we check a micronutrient panel every 6 months. We do meal planning with them. We encourage exercise. We do give them exercise plans. Some do, some don't. And then the fourth thing that we've added that's been a huge value add for our patients, quite frankly, is prescription hair support. Because when you're in a calorie deficit, your body tends to triage, right? It tends to get rid of the things that are less important. And hair, we care about a lot emotionally, but when it comes to survival, hair doesn't matter, right? And so one of the first things that happens, people start losing hair because their body's like, okay, we're going to put the calories into the vital organs. That's what it's going to do. So we have prescription hair support. We have laser hair support that we kind of package with our GLP-1. So what we say to our patients is, listen, you can get GLP-1s on every street corner now. You can go to Hims, Hers, you can get it cheap. It's everywhere. Yeah. What we are going to give you is GLP-1s in the context of health, nutrition, and wellness, and hair support. And we're going to make sure that we're doing it in a way that is sustainable. It's going to be good for your body in the long run, that you're going to come out on the back end and hopefully be able to come off of them with a healthy lifestyle. And that's our goal in the practice, as opposed to just like, you want to lose 30 pounds? Cool. Here's a bottle,
Yeah. I actually really like that, because this is a point that I think most people that are consumers especially do not understand. When you're a provider, like you're saying, you're trying to understand, like, what is the patient actually going to commit to and do, not so much what is the most ideal thing that they can. And this became pretty, like, there's one point that I have that I actually have never shared this. I was talking to a provider, and one thing that has always irked me is when, Western medicine doctors would say, you're in remission, and you're in remission, you're in remission. I'm like, the reason I never like that for context was it always implies that something is wrong with you for the rest of your life. And therefore, you're kind of boxing that person into like, I always have this disease no matter what, even if it's not in the body at that time, right? So I never personally like that. And so that's my purview. I know some do not agree with me. But one doctor said to me, the reason we tell people that they're in remission is because we don't do that, they're going to go off the wall. Like they're going to think that they're good and then just do everything they're not supposed to.
Yeah.
But if I tell them they're in remission, they're always worried they're going to mess up. And so they're actually more compliant. And that, like, you know, it was like the first time where I was like, so you know that that's what you're doing. He's like, yeah, I have to do that, you know? And I was like, oh, now I'm starting to understand. But it's to your point, right? I think that's actually valid, is like, what commitment is that person actually going to do? And as a care provider, you're trying to balance the wants, the needs, and the optimization. So I do appreciate that framework. I know we have a little bit of time left, so potentially the last thing I'd love to dive into is, because you have this whole care package now with the GLPs, nutrition planning, etc., have you seen that people are staying on that longer, more excited, more motivated, and feeling more supported versus before when they were just on the GLPs and getting out of the office?
Yeah, you know, I will tell you what I will tell you what my experience has been with that. When people are on GLP-1s and GLP-1s only, and they're not doing sort of the nutrition, diet, exercise, hormone supplementation, they lose weight. I mean, like everyone knows they lose weight, right? And then, but the problem is they can't come off the drug. Now, how much of a problem is that? You know, technically, you know, if the goal is to remove the visceral fat, remove the sort of, you know, inflammatory, you know, sort of obese metabolic, you know, disruption state, and you know, staying on the medication forever does do that job, like it does. But when I talk to my patients, the vast majority of my patients want to come off. You don't feel great when you're on GLP-1s. People want to your point, they want to be in remission, right? They want to be healthy. They want to be healthy and feel like they can, you know, control the health of their body themselves. When people try to stop GLP-1s without, or taking a step back, apologize, I'm going to go off on a tangent. I promise.
Go. We'll come back.
It's going to be a good tangent. Okay. Yeah. So the problem is, I think of metabolism like it's a dial, right? So metabolism, as most basic, is a decision that your body makes. Every time a calorie comes into your mouth, your body decides, am I going to burn this either to build muscle, build hair, you know, build stuff, fuel, heat, or am I going to store this as fat, right? And each calorie that comes in, your body is deciding. The problem that we struggle with in our society, or, you know, in all societies, is that when we are young, our metabolism is set to burn. Generally speaking, calories come in, they get turned into energy. We have all this energy, we're not heavy. As we get older, our metabolism shifts and it basically goes into storage mode. So you eat, but the food doesn't give you energy. You're tired and you're fat because the food, instead of being energy, burned as energy, is being stored as fat. So you go on a GLP-1. Well, that's great. Okay, well, the GLP-1 will take care of the fat, and that's important. Like I don't want to gloss over it. That's important. But as long as your metabolism is still stuck in that sort of storage mode, as soon as you come off the GLP-1, you'll still be tired and you're still going to gain the weight back. Because in order to actually solve the problem, you got to shift the metabolism. Right? Now, there's a couple different ways you can shift metabolism. And there's sort of a handful of ways we can do it. We can do it with hormone optimization. One of the major reasons our metabolism slows down is because as our hormone production drops off, the genes that tell us to use the calories in productive ways get turned off. So they get stored as fat as a default. Exercise does it, but you can't exercise without hormonal support because your tendons and your bones start to weaken over time. And you get into that injury cycle that the people in their 40s do, where you're starting to get fit and you get injured and then you lose it and then you get injured again and you lose it and you're back and forth, that cycle. That's a great place to be. But so with our clients, what we try to explain to them is, listen, the purpose of this drug is to pull the weight off, but it does not change your metabolism. When you hit your goal weight, our goal is then we take the GLP-1 away, and now our goal is to shift your metabolism back into a state where you can burn the calories so you can come off the drug. And we do that with exercise, because I mean, exercise is one of the biggest determinants of our metabolism. And we do that with hormone support and nutrition support. And if we do that, you can come off the GLP-1.
Yeah. It
works. It does. If you don't do that, you're going to need to be on it forever, or you're going to gain the weight back. And it's up to you. And I will tell you, about a third of people are willing to put in the effort and stay with the program and will come off the drugs. About a third of people will be on long-term maintenance, and they kind of go halfway. They do some of it, but they still need shots every now and then. About a third of people will be on them forever. And that's the human nature that we're dealing with. But if a person is willing to commit to the program, they can absolutely come off 100%.
Awesome.
Yeah.
Perfect. We'll end it there, Dr. Flora. Thank you so much for your time. Where can people connect with you, contact you, and follow you?
Yeah. So the best place, if people want to connect with me, really is LinkedIn. There's only one Flora Waples in the world, so I'm very, very easy to find on LinkedIn.
That's awesome.
And that's the best place for any kind of professional connection. For patients, I would encourage you to go to our website, which is just www.restoremedicalspa.com. No E, because we're very hip, so it's just Restore. And find information about all the services and everything we do there. But those would be the way to contact me. And I really welcome and love to talk to my colleagues. I love to talk to patients. This is my life's mission. So don't be shy if you want to contact me.
Perfect. We'll link that in the notes below. And thanks for being on the podcast today.
Well, thank you so much for having me. This was great.
Awesome. We'll cut it there. Thanks so much. I really like the combo. I think it exposes a lot of conversational points that providers and patients have. And because we have a lot of data, you're really on the right path.
I hope so.
We're seeing that we're seeing end users, like, they can get it anywhere, so they just go coupon hunting. So they're like, I'll just get the Wegovy or GLP-1 somewhere. But then they're like, this sucks. Like, I want to get off it. I'm puking. My stomach hurts, whatever. And like, there's no real plans or pathways. And so then they come back to providers. So.
Yeah, 100%. But they think they're looking for weight loss, but they're really looking for is health, right? Like that's 100%. What humans are really searching for is health, and you can't get health from a GLP-1. It can help you on the path, but it's not the be all end all. But thank you so much. I always ask, what could I have done better? What were the things that I said that were the most sort of impactful or useful?
I think the 3 breakdowns of like what you saw is going to change healthcare was really, really good. And then what you could have done better. I think you were really clear, to be honest. Let me think about that, and I'll shoot you a PM.
Do, and I would love that because I asked that question in all sincerity because I think I'm brilliant, but I always,
sure. And you should,
every word is golden, but I always want to get better, and so I would anything you can give me would be awesome, and I would take it seriously. So thank you.
For sure, no problem. I'll be in touch with the notes and all the when we release it, and if you would be interested, I think we could potentially talk about a partnership, especially on the nutrition side. On some of the tech that we built. So I'll send you a PM if you have time this week or next week, just a 15-minute.
Do that. No, I would like that because managing it is a beast.
Yeah, so that's kind of why I wanted. When you said that, I was like, I think we could probably connect on that.
I would be very open to that.
Okay, perfect. I'll show you some time slots and see if those work for you.
Awesome. Well, thank you. And again, thank you for taking the time to talk with me. I appreciate it. And I hope you have just a wonderful, wonderful day.
Thank you, Dr. Flora. Have a good one. Bye.
Right. Bye.
That's it for this episode of The Health Signal. We hope you're leaving with one small insight you can use and one big idea to explore. If you enjoyed this conversation, be sure to follow The Health Signal podcast and leave us a review if it helped simplify something complex. To learn more about how Thea is helping providers and patients make data-driven health decisions, visit theahealth.ai or check out the links in the show notes. Thanks for listening, and we'll catch you next time.